Hey guys, good morning. This is my first video on YouTube and I am very scared. I'm freaking out, but it's like a big step for me. This is something I always wanted to do as part of me giving back to, well, to the community, I guess, because these are the things I wish I knew um, before coming to Jamaica. Um, so yeah, this is why I'm doing this. I have no financial incentive. It's just for me to just give back. So today we're gonna try and talk about how to practice medicine in Jamaica, and this is from an IMG perspective. Um, so quick things about me that you need to know is that I'm an actual medical doctor. I'm not pulling this information out of thin air. I'm an actual medical doctor. I did my medical training in Haiti, born and raised in Haiti, but also did my medical training there. I graduated medical school in 2017, and I came to Jamaica in 2018 with no specialty training, meaning no, I was like fresh out of medical school. And this video is meant to be an overview of what you actually need to do to be able to work in Jamaica as a doctor. So, in order to work in Jamaica, you need actually two things. You need the work experience and you need the assessments as well. So, what I mean by work experience is that in order to practice in Jamaica, they want to make sure that you will be able to safely practice in Jamaica, meaning that you know the ins and outs of the medical system, how things are done, so that you can essentially start practicing on your own eventually. And also, in order to be sure that you can actually safely practice, you also need some assessments that we'll talk about in details later down the road. So, what I mean by work experience, so they want to make sure they want to be able to assess you for a certain period of time to make sure that you're qualified enough to work. So regarding that, you're gonna have to do 4 months of observership, um 12 months, essentially a year of medical internship, and 1 year of being a senior house officer. I'll get into details of that later down into the video. Also, you will need you need to be assessed. Um, so the way they assess you is using the Caribbean Association of Medical Council exam, which is called CAMC. It is somewhat similar to the step one, like like step two CK and step two CS, because you have two parts, which is part one, which is the clinical knowledge, and part two, which is the clinical skills, where they assess you. And also throughout your period of working in Jamaica, doing your observership and internship, you'll get assessment at each rotation or clerkship, if that makes sense. So as I said before, you need to be working for them to assess you. And the work, quote unquote, is the observership and the internship. So, in order to apply for that job, because it's essentially a job, because it's a paid observership and internship. So, in order to apply for that job, you'll need your transcript from an accredited medical school, and I think this can be found online. I do not remember the website, but I will attach it in the video description down below so you can check it out. It's usually like a registry for all the medical school around the globe. So your medical school, if it's accredited, is supposed to be in there. You'll need your medical diploma, and for myself, because my training was made in French, Haiti. For the people that don't know, Haiti speaks French and Haitian Creole. So most of all of my training was in French. So yes, I had my medical diploma, so but I still needed to have it translated um, for them to be able to read it because Jamaica speaks English. Also, you'll need a letter of good standing, especially if you're not Jamaican. Just to say that you have not committed any crimes in the past and yada yada yada. You'll need your birth certificate. That would also I needed to translate that again, French. You'll need your vaccination report card. It's not just about your vaccination regarding COVID, but a general vaccination report card. You'll need a couple of passport size pictures as well. You'll need your CV, and you'll need 2 or 3 reference letters. To be on the safe side, I would recommend having 3 reference letters. And with all of this, um, because it's an entire process. So with all of this, you'll apply to the job. Now, once you get the job for the observership and internship, um, the Jamaican government, the medical, oh my God, the Jamaican government will grant you a work permit exemption through their different regional health authority. But I'll get into much more details if you guys want in a later video, because the medical system in Jamaica is essentially decentralized, where they have what they call regional authorities, which are responsible for managing medical doctors and other stuff when it comes to a certain region of the country. So yeah, you'll need a work permit exemption from them, and you'll have to pay for that. But as I said before, I'll get into details for that later down. Now, the observership, it lasts a period of 4 months. At least for me, what I've observed since I've been in Jamaica is that it usually starts in September and ends in December. Certain people do it differently, but this is what I've observed for the majority of people. They usually start their observership in September. Now, during those 4 months, you'll rotate through the 4 core, what they call core rotations, which are internal medicine, pediatrics, obstetrics and gynecology, and general surgery. For each of these rotations, you would not be expected to be performing any sorts of tasks, but I would say act on it, meaning be very proactive. Like if you have to start writing the patient's notes, do that. If you have to take blood samples, if you can, under the supervision of your intern, which would be your superior, quote unquote, you can do that as well. You have much more flexibility during that observership, and meaning that you can choose not to do anything, and it's not expected of you to do these things. But what I saw is that you get the most benefit out of it if you're actually proactive. So, help out your intern because they're overwhelmed. So as I said before, you're going to be rotating into internal medicine, pediatrics, obstetrics and gynecology, and general surgery. You're not expected to be on call during your observership. You work from essentially 8 to 4. You don't have to do, and you're paid for it, by the way. You're not just standing, you're actually getting paid for it. And at the end of each rotation, you're assessed by your consultant, or what they call consultant here, which is in the US what they call the attending, at the end of each rotation. So now after the assessment, each assessment you end up passing your observership, then you move on to your internship. There's no exam. So these assessments are given at the end. It's like a general observation. It's not like a written exam that you'll have to take. It's just the consultant's observation of you throughout the entire month. So at the end of each month, you get one assessment, and with all those four assessments, now you apply to become an intern. Essentially, it's very streamlined. There's not much for you to do. You just go back to the medical council, and then they grant you a letter to start internship. Oh, and by the way, during observership, you're not allowed to sign any prescriptions, or you're not allowed to sign any forms of official document because you're technically not supposed to be practicing. Now, internship usually lasts 12 months. So, after completing your observership, after the 4 months in December, you would start internship usually in January. And you rotate, you have to rotate for 3 months in each core rotation, just like previously. So it would be general surgery, internal medicine, pediatrics, obstetrics, and gynecology. During these rotations, now you're actually the intern. So, meaning you'll have to see the patients, you'll have to write on your patients, you'll have to take the blood samples, you have to do the physical examination. You're actually a junior doctor. Um, so you have much more responsibility, and you're expected to be on call as well. So depending on which rotation that you're on, you can expect to be on call either 5 times to 10 times for the month. And it can be very gruesome, especially for general surgery. And at the end of each rotation as well, you'll need to provide an assessment form, and the consultant will give you, your passing grade. Now, with all of these four assessment forms, um, you can proceed to your next step, which is becoming a senior house officer. Being a senior house officer, or SHO, is actually not mandatory to get a medical license, but it is a requirement if you want to um, do a specialty in Jamaica. Meaning, if you want to do either internal medicine, anesthesiology, orthopedics, pediatrics, you'll need that year of experience, because it's like what they call like foundational training for them, to make sure that you're actually interested into a certain area. So you get to choose which specialty that you wish to rotate in. Unlike internship or reservership, where they impose that you have to rotate through the core rotations, you can decide to work in, let's say, for example, radiology or anesthesiology, or you can also choose back to work in pediatrics if you want to, if you're interested in the field. It gives you additional experience and autonomy. And I would say that if you know when you're coming to Jamaica, you would like to do your residency in, let's say, for example, pediatrics, I would say go back to pediatrics, work an additional 6 months or an additional 8 months if you can, to make sure that this is what you want to do first. And second of all, to show when you're applying to residency, to show that you're actually interested into the in the area. If you've not had any previous work experience in that field before. So yeah. Now, onto the assessment. So, as I said before, you'll need to pass your CAMC exam. And the CAMC exam can be taken before, during, or after your internship, meaning that you can start getting ready and passing your exam, before even coming to Jamaica or other countries that practice it. So, the CAMC itself, while not needed to do your internship or observership, it is needed to get your medical license. So it's with your internship and your CAMC exam that you get your medical license. Some people actually don't need to get past the CAMC. Those people would be the people that are fully certified by ECFMG, meaning the people that had taken their step 1, step 2 CK, step 2 CS, and I believe step 3, and also people that have taken these US equivalent exams either in Canada or the UK. These people won't need to sit the CAMC, but they would still need to do the internship. Now, back to the CAMC. The CAMC, it's a pass or fail exam. It's not as if they're going to give you like a centile or they're going to give you like a grade or A plus. No, it's either you're passing or you're failing. And it consists of 2 parts. Part 1, which is your knowledge assessment, which is essentially a computer-based exam where they test your knowledge on different topics that are prevalent mostly in Jamaica. And I feel like it's the equivalent of a step 2 CK, if that makes sense. And there's part 2, which is a clinical skill assessment, where they objectively assess your clinical skills. I think they call it OSCE. No, they call it OSCE, where they assess you, the way your reasoning, how you examine your patients and whatnot. It consists of 12 stations where, they assess you for basically almost each specialties. So yeah, you'll be giving a topic and you'll essentially have to behave like a doctor, essentially, which I assume that you would be capable of doing. So what I've noticed is during my internship, I actually did the part 1 during my internship and the part 2 at the end of my internship. What I noticed is that, especially for the part 2, you can gain a lot of insight for this exam while going through your internship. Meaning you get to practice while you're going through your internship, you get to practice as they want you to practice or behave during these exams, or as they want you to reason during these exams. And this is why sometimes, while I say that you can take these exams before you do your internship, I believe that doing the internship give you much better insights, because doing your internship as well, you're working with an intern, other interns, but you're also working with medical students that are taking an exam that's similar to this, but it's much bigger. So you could see how they do things, and essentially you'll be able to pass the exam by mimicking essentially what they're doing. This is what I did. And I believe that it actually helped me. Now I can make another video regarding, how to actually study for the CAMC exam if you guys want, but this is an overview. So now, with completing the observership and the internship, and after successfully passing both parts of the CAMC, you are now becoming eligible to start working as a medical doctor in Jamaica. Meaning you're eligible to work as a general practitioner, either as a general practitioner, or if you have a specialty before coming in, and if they recognize it, you can actually start working as that practitioner. Meaning, if before coming to Jamaica, you were, let's say, a trained anesthetist back in your country, you can actually start working as an anesthetist in Jamaica. And this, by the way, it's through the Jamaican government, through the Ministry of Health of the Jamaican government. I do not have any experience for the private sector, but this is what you actually need to practice. And the Jamaican government would be the one giving you the medical license anyways. I assume that the approach would be similar. But essentially this is what I did. So that's it for this video, which was my first video. Hopefully it helped. if somebody needs more information, I can try and do another video on a similar topic. But yeah, these are the informations that I wish I knew before coming to Jamaica. Other information I wish I knew is how much you get paid as a, medical doctor in Jamaica. If you guys want, I can also speak about that in another video. So yeah, thank you guys.